Evidence-based practice is it's a combination of both what we know works, or what research has shown can work for certain populations in certain places, with the local context and needs, and the clinician or the program provider's best judgment on what's appropriate in the context.
What we gain from using evidence-based practices is kind of the ability to start a project that we know has already been found to be effective, rather than having to reinvent the wheel or have to create a project from scratch.
Working at a systems level in order to meet the needs of the most amount of people possible, it's really important to be able to be effective as quickly as possible. And there's not always the room for trial and error and experimentation because there's limited resources, and having to create success with limited resources, evidence-based practices really helps to have a success that you can evaluate and adapt to something specific to your needs.
This project really did a good job of helping build momentum in our state around family professional partnerships, especially within children and youth with special health needs. And so I think without having this project, that momentum wouldn't be there. It'll help us in being able to recruit more diverse parents to help us and to provide meaningful input back and forth and really meaningful partnerships with our families in this state.
It was really a valuable experience to have an opportunity to replicate a best practice because it's very collaborative with our family leadership. In order to truly have family and professional partnership, it really needs to be an equal relationship.
Done well, implementation gives more voice to consumers and providers and the various staff that work in the program. So everyone has some higher level of accountability that if done well, if implementation is attended to well, more people feel accountable and a part of the change and a part of the work. It's important because we do know a lot about what works, and we should not be guessing or winging it or just doing what we've always done. We should be leveraging our own experience and the needs of the community and their own experience, plus all this great evidence that's out there. So that's really incumbent upon whoever the practitioner is and the agency or system they work in to really support that.
And so having an opportunity to look at what other states are doing, and particularly a state that's doing it really, really well in a very different way, really helped, I think, to get people thinking and brainstorming, how could we do something for our state that would apply for our specific needs, and then we can create something that's unique and specific to our own state.